Thank you, Mr. President. Thank you, Mr. Senator Sparks. Senator Sparks, on page 1, line 39, where I think I'd heard a exchange of questions on what has to rise to the definition of sincerely held moral convictions. It says here on line 41, a belief in or relation to God, B, a religious faith or spiritual practice, or C, a moral philosophy or ethical position without regard to whether the philosophy or position is related to a religious faith. So it could have nothing to do with a person's faith. It could be on C, a moral philosophy or ethical position without regard to. So you're proposing that we pass this bill that would apply to, I think it starts, healthcare facilities start on line 57 of page 1. And then on page 2, it goes on to say private physician's office, pharmacy. Now, where I get a concern here is this also would apply to a nursing home. And underneath that, a nurse, a nurse's aide, a medical assistant, a hospital employee, allied health professional. So what if there's a patient in a nursing facility that is espousing views that are in contradiction to that person's, the definitions that you had over here in the beginning, their belief or relation to God, their faith, or their moral philosophy? Would someone, a nurse, a health tech, an employee in a nursing facility, would this bill give them the reason the excuse to decline to participate in that health care service because of their conscience?
Yes, I believe it would. And it would require the facility to have the protocol in place as to how that would actually transpire.
So whether it's someone sitting in a nursing home needing help to do something personal, how would the loved ones of that patient know that they had been refused service? Would the person self-report? Would they go to tell their bosses, we're not going to serve them?
The way the bill is designed, again, is that would be spelled out in a protocol. And so, yes, that worker would basically self-report and acknowledge.
So would this apply to people who go to people's homes to provide them services? There are many Texans who want to live independently in their home, and they just need assistance in the morning, sometimes with a colostomy bag or getting out of bed or some medicines. Then that person leaves the home, and then they go on to someone else, and that person stays and living independently, and it helps the state. It's cheaper than putting someone in a nursing home, and it's better for the person who wants to maintain their independence. Would this apply to them too?
I believe it would apply to them, yes.
And what if you're in a small town that doesn't have a lot of these attendants? If there's not another one readily available, what does that patient do then?
Well, again, that patient is getting these services through some type of organization, and that organization is required to put together their protocol ahead of time. I think sometimes we look at these, we look at legislation like this, and we try and come up with the absolute worst case scenario. I would say again that people that generally go into these types of fields are predisposed to wanting to be caregivers to others.
This is true, but I think my fear, Senator Sparks, and I know that you come at this from a place where you're not wanting anybody to not be served who needs it, but My fear is that if this were to become law, that there would be people that would see this as the ability to have just because it's in black and white on line 43 of your bill, a moral philosophy or ethical position that's contrary, that is sincerely held moral conviction, and their philosophy is in direct opposition to the person they're being asked to serve, and that we might inadvertently have someone get hurt in the time that it takes from that person who's refused services to the time that they get someone who will serve them. And so I just don't think that I think the potential loophole or license to discriminate that it gives is, it creates a dangerous position. But I do appreciate you taking my questions.
Well, and I appreciate your concern and appreciate your questions today. Thank you.
Thank you very much. Thank you, Mr. President.